If you have been diagnosed to have glaucoma, what is it that you need to know? Glaucoma is a silent thief of sight. Hi, I am Dr. Sati. I am a glaucoma consultant at the glaucoma department at Narayan Nethralaya. Today I'll be talking to you about a few points that would help you cope and live with glaucoma. So, if you have been diagnosed to have glaucoma, what is it that you need to know? What do you need to be aware of so you can cope with glaucoma? So the first and foremost thing that you need to remember is that most patients who are diagnosed to have glaucoma, especially if they've been detected early, can lead a normal active lifestyle and continue to do most of their daily activities without a problem, especially if they're compliant with their medications and go for their regular follow-ups. So the key here is that the diagnosis has to be done early and that the patient is compliant with the medications. So remember that when you start using your medications, the drops that have been given to you, make sure that you follow the regimen properly according to what has been prescribed. It may be twice a day, it may be once a day, but follow the regimen properly and also make sure that you never miss a dose of the medication. Even if you forget it on a day, even if you remember it a little later, maybe half an hour later, 1 hour later, it's fine. You can still use the medication, but don't miss to use the drops. Today's technology, you can use a lot of things that will help you to use these medications without forgetting, as simple as just keeping an alarm on your phone or just associate with a daily activity. It can be with your breakfast, with your dinner, before, after, whatever, but associate it with something so that you don't miss using these medications. The medications are known to cause some side effects. This is the small price that we need to pay to preserve the vision. Make sure that even if you have these minimal side effects like mild redness or mild burning, you don't stop using these medications. You can inform your doctor when you meet for a review regarding these side effects and the doctor can give you some additional drops to take care of these problems. However, if your side effects are very severe, the doctor may even consider changing the drop to something that is more suitable for you. Now, the next important thing is that even if you're using your drops regularly, you may feel that your vision is quite good, you're doing all right, then why do I need to go to the doctor? I'll just continue to use the drops. Now that is not correct. You would need to continue to have reviews with your doctor because glaucoma is a silent thief of sight. So even if you're losing vision while using the drops, you may not be aware of it. So whether the drops are actually doing the job, continuously controlling your pressures, whether your fields are stable, all this will be assessed during your checkup with your doctor. So make sure you go for regular reviews with your doctor even if you're using these drops regularly. Also, whenever you visit the doctor, make sure that you're using the drops in the right manner. The technique in which you use the drops is also important. Make sure that you use it in the right way. So you can continue to lead a healthy lifestyle. Take a good balanced diet and a moderate amount of exercise is good for you. If you're into yoga, you can continue to do that. Just ensure that you do not practice any headstand kind of postures. Now, if you have a little bit of restricted vision due to the glaucoma, it would help you to have good illumination in the house. Use extra lights and make sure that the place is always well lit. You can also use a monitor or a device to read material where you have better contrast and where it is easy for you to use magnification. If you need to use stairs, you can use a contrast tape at the edges of the steps that will help you identify the steps when you need to climb up. So these kind of small modifications would help you in your day-to-day activities. Bright colored objects which would highlight things that you need to identify would help you in your day-to-day work. When it comes to driving, if your field defects are early defects, which you can find out from your doctor, you could still continue to drive normally. Most glaucoma patients do have a little bit of difficulty with dim light, and so you would consider to avoid driving at night if you have glaucoma. However, if your glaucoma is advanced and your field loss is advanced, it would be best to avoid driving totally. Also, if your field loss is advanced, you may even require help or to be accompanied by a person even if you have to go on a busy street. Also, you can take support from your family and friends. Where you need help, do not hesitate to inform them of your areas of where you're facing problems and take their help. At the same time, try to maintain as independently as possible that you can do your activities, you can continue to do those. You can also join a support group for glaucoma where you can discuss problems together and share information. Thank you.